Hi everyone, welcome to Dr. Ties, your medical expertise whenever you want. Please note that this is strictly for educational purposes and not intended for a formal diagnosis or treatment. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Today's topic is anxiety and how this is managed. Anxiety and generalized anxiety disorder are commonly used to describe excessive worry. Although they are related, they are not the same. Anxiety is a natural response to stress and danger, and it is usually a temporary feeling. Most people feel anxious sometimes, and this is a normal feeling. This is not always a medical disorder unless it becomes chronic and impacts the daily life of a person. Generalized anxiety disorder is considered a mental health condition, and it is characterized by chronic, excessive and uncontrollable worry about various issues such as health, disease, work and relationships. This can last for 6 months or longer. There is usually no obvious underlying cause for generalized anxiety disorder, but the risk can be higher if there is positive family history of anxiety disorder, another anxiety disorder like panic disorder, past traumatic events, chronic illness, or history of alcohol or drug abuse. Generalized anxiety disorder is a common mental health condition, and it is more common in women than in men. The symptoms can vary from person to person and include fast or racing heart, palpitations, sweating, rapid breathing, trembling, restlessness, upset stomach, concentration and sleep difficulties, and a sense of impending doom. Low mood or depression can also occur with generalized anxiety disorder. Generalized anxiety disorder is different from panic disorder and phobia. Panic disorder is when someone gets sudden attacks of anxiety and panic. A phobia is an overwhelming fear of something specific such as heights, spiders, closed spaces and germs. The diagnosis of generalized anxiety disorder is usually clinical, although sometimes a blood test may be required to check for thyroid dysfunction, hormonal imbalance and vitamin deficiencies. A generalized anxiety disorder questionnaire or tool can be used to help with the diagnosis. There are various treatments for generalized anxiety disorder, and these are aimed at managing the common symptoms. It can take several weeks to see improvements in anxiety symptoms. The common treatments include medication, cognitive behavioral therapy or CBT, talking therapy and counseling. The medicines used to treat generalized anxiety disorder are a type of antidepressant called SSRIs, which stands for selective serotonin reuptake inhibitors. This type of antidepressant works for anxiety as well as depression. The decision to choose the appropriate treatment depends on the severity of symptoms and patient's preferences, and talking therapies can be tried first before starting a medication. If conventional treatments do not work, it is advisable to see a specialist for further assessment. The symptoms of anxiety can be relieved with various self-help measures and techniques. Talking to someone usually helps with the feeling of anxiety, and this could be a family member, friend, counselor, or Samaritan. Self-help therapies through books, online tools, and courses can be beneficial. Slow, deep breaths can reduce anxiety by helping the body switch from a stress response to a relaxation response. Inhaling for a count of 4, holding for 4, and exhaling for 4 is a known useful technique. It is important to focus on breathing deeply into the abdomen, which engages the diaphragm and calms the nervous system. Picturing a calming place like a beach or forest can engage the senses and promote calm. Getting adequate sleep to have better energy, regular exercise and healthy diet are also recommended. Walking, jogging, running, swimming and yoga can reduce anxiety and stress. It is advised to not focus on the things that cannot be changed, and it is better to focus on various techniques that can work to feel calmer. It is recommended to avoid excessive amount of caffeine-containing products such as coffee, tea, cola and energy drinks, as these can disrupt sleep and aggravate anxiety. Smoking, excess alcohol, drugs and gambling are to be avoided, as these can lead to more problems with mental health. If there are symptoms of anxiety, it is advisable to see a doctor in person for full assessment.